I had a client bring her 2-year-old to me yesterday. She was concerned that he isn't outgoing enough, he's not sleeping well, he's constipated, and she just wants him to be like all the other kids. She's taken him to multiple doctors to try and figure out what's wrong with him. So I started asking her, what changed when this all started? And he was about 4 months old. He stopped breastfeeding. And so I asked her, okay, were you taking any medications? Were you taking any supplements? What was your diet like? What was your stress like? She said, yeah, a little bit of stress, no medications, no supplements. My diet's been the same. I said, okay, tell me more about your stress. My husband and I, we've been dealing with a lot of things and don't really see eye to eye. He can be a little aggressive and this and that. I said, okay, so what's the energy of your home? How has your energy been? Have you been in a place of gratitude? Have you been in a place of anger, resentment? Where have you been? With a big sigh, she just puts her head down and she starts to cry. And I let her cry, let her release it, and then asked her to talk to me about it and what's been going on. And she explains that her husband and her have not been seeing eye to eye, that he makes her angry and sad and disconnected, and she hasn't been feeling love towards him in 2 years. And that he's trying, but it's not enough. So I had to teach her. I had to teach her that her son absorbs all the energy in their home and that he's feeling it all. And so if she has been operating in sadness and anger and resentment, he's feeling all that. He's absorbing it. And he doesn't understand. He's probably confused and sad. And she started crying more. And she said, yeah, you're probably right. I never thought of it like that. I never thought of that. She's like, all these doctors, they wanted to give him medications. And I knew something else was going on. I just didn't know what. And I said, yeah, it's you. You have to heal you and your husband's relationship. This is an opportunity for you to heal childhood wounds if you're open to it, if it's salvageable. If he's committed and you're committed. Crying more, releasing more, guiding her through the body in a somatic way, going through the anger, the sadness where it is, helping her process all these emotions out. Because she was keeping them inside and her son was feeling it. And of course, we talked about diet. We talked about other things that we're going to rule out. But we have to start there. We have to start with the energy of the home, the emotions that are not being processed. And no one ever asked her how she was feeling or how her and her husband were doing. See, this is where Western medicine gets it wrong. I'm sorry, but I'm not. Doctors need to be educated on the emotional health of their patients because that is at the root of all illness. All. It's not even illness. They're just symptoms. We'll talk about that in part 2.